The following segment is presented by Bremo Pharmacy.
Well, many people think that only young children need vaccines, but the truth is that older adults have complications with vaccine-preventable diseases every year. And here to tell us more about that is Jenny Helmke from Bremo Pharmacy. Thanks for joining us.
Thank you.
So tell us about some of the diseases that people can really prevent in their adulthood by getting a vaccine.
So some of the most obvious vaccines are flu shot, which everybody should get every year, but also as we get older, we want to be sure people are being protected from not only pneumonia, but the shingles. And shingles is what we're going to talk about today because it is something that can be very, very painful and have lasting effects if you are exposed to it.
You know, I don't hear too much about shingles, and you're right, we always hear about the flu shot, but what is shingles and who is at risk?
Shingles is actually a virus that stays in your body once you've had chickenpox. So the chickenpox virus will stay in your nerves and will come out later in life. So you will develop, at any given point later in life, a red, itchy, blistering rash. Typically it's one-sided, long nerves on your arms, on your back, but even can come on your face.
Okay, and what does it mean by one-sided rash?
So if it's a rash that only is going to come up on one side of your body versus an all-over body rash.
Okay, and what are some of the serious complications as a result of getting shingles?
So when you actually develop the rash, it can be very painful. It can leave scarring, but once the rash actually clears up, it can leave nerve pain in that area, but also if you get it on your face, you can get it in your eyes and can cause blindness.
And is that chronic blindness for the rest of your life, or can you recover from this?
It depends on the particular case.
Really? Okay, so you suggest that people come in and request the shingles vaccine. At what age should they be requesting it?
Currently, we can give the vaccine from patients that are 50 and older.
Okay.
The CDC current recommendations are 60 and above, and most insurances are covering the vaccine for patients who are 60 and above. But we do recommend that patients at age 50 and older come in to get this vaccine because it can prevent the rash from coming up.
Okay, so if you get this vaccine, are you pretty much free from being susceptible to shingles for the rest of your life?
With any vaccine, there is a small chance that you may still develop the vaccine or the virus, but with this vaccine, it's covered about 65% of the patients.
Okay.
However, if you still get the shingles outbreak, the symptoms are going to be less severe.
Okay, now what if there's an adult or someone who says, well, I've had shingles, so I don't need the vaccine? Is that correct thinking?
Actually, patients who have already had a shingles outbreak, once that rash is healed, it's recommended that they do get the shingles vaccine to help prevent any further outbreaks because, unlike chickenpox, it can come back, and it comes back in a different area, so it's going to affect a different site.
So if you get shingles at one side of your body, then it'll present on another side, and I mean, who wants to go through that twice in their lifetime?
Nobody.
Okay, now you say that there are also a group of people who should not get this vaccine. I'm sure it's a small group, but tell me why.
Yes, so because this shingles vaccine is a live deadened virus, we do not want to be giving this vaccine to people who have a compromised immune system or are on medications that lower their immune system. So we don't want those people to get it, or anyone who is going to be pregnant or is allergic to any component of the vaccine.
Okay, so people with lupus, I'm thinking, and then pregnancy lowers your immune system and other diseases. Well, thank you so much, Jenny, and if you at home want to find out more information about the shingles vaccine, visit BremoRx.com.